Lastly, there are people who have taken the time to help families navigate situations when it comes to health care. I sat down with patient safety advocate Michele Monserrat-Ramos. She's worked with families here in Bakersfield to educate them on the resources they can utilize to learn more about their health care providers. She also started doing this work because of her own personal experience. I'm joined with Michele. She's a consumer advocate, and you've worked on a lot of these cases with a lot of families here in Bakersfield and Kern County when it comes to medical negligence. First, tell me how you kind of got involved in this work.
Well, actually, I became a patient advocate because of my own tragic loss. I lost my husband to be 3 days following elective surgery, and I was like every single one of the Kern County families that I work with today. Something that shouldn't have happened, completely unexpected, and you don't know what to do. So I went through a process. I investigated his death because I was given no cause. I went through the medical board process, everything all the families here are doing. And so having gone through that process, I became a state and national advocate, where I work with advocates across the state, across the country, on various issues. And from then I transitioned into legislation. I worked on changing some policies with the medical board and was able to get through legislation for a number of things, including the Patients' Right to Know Act. So I did all of these things, and now I work with Consumer Watchdog, and I work with families across the state of California to help them navigate through this entire process from the moment. Sometimes they have a family member that's still in the hospital, and there's still time to help them. And there's been a local Bakersfield family that I've worked with through that process. Other times there's other families that they've faced a tragedy and they don't know what to do. And because I've gone through the entire process, I've hit every wall, I know everything that can go wrong. I'm able to help them navigate through the entire system. But it's based on my own personal loss.
Well, thank you for, turning your tragedy into triumph and helping others, obviously. And you've worked with, like you said, a lot of families across the country, across the state, but also families here in Bakersfield and Kern County. In your work, and a lot of families I spoke with, and even the numbers that I've seen on, the California Department of Public Health website, have you seen more medical negligence here in Kern County in your work?
Yes, it was actually shocking how much more medical negligence, how much more harm I saw here in Kern County than anywhere else in the state. And, the first family that I actually reached out to, and I helped them. And then there was an article that came out and some press coverage, and a number of families started reaching out, and it was almost like a domino effect. It was shocking how many people reached out. And there was nowhere else in the state where that many people in one community, and many with this were harmed by the same physician. So I knew once I had an entire group of people that needed help, I knew that I needed to spend some time and focus my efforts here in Kern County. If
people feel like something is wrong, what is the first thing that they should do, and how early can they do it? I mean, you talked about pregnant mothers, right? Like when should they, say something, and how can they say something, and what can they do?
Well, initially, when it comes to pregnancy, when it comes to chronic diseases like cancer, dialysis, you really need to take an advocate with you. When you're sick, when you're hospitalized, you're in more vulnerable state, and you're not going to catch everything. There's some questions you may forget because you're just not feeling well, and many times you're afraid. And so you really need, if at all possible, you need to bring an advocate with you. The person that is going to help you ask questions, the person that is going to ask for a copy of your labs. As many times the healthcare professional will come to your bedside and said, labs are taken first thing in the morning, and they're like, oh, your labs are fine, you're doing okay, we'll do this. But many times, if you don't see that copy of those labs, there are some numbers that are off. Things that long-term wise you can work on. And many times you don't know. You don't know until it's too late, and you end up with, a complication that's become an issue. You end up with a chronic disease. And so those are some of the things that you can do for yourself early on. Another thing that you can do is look at the background of your physician. Look into the hospital. Your local hospital, a lot of people are part of a healthcare group, so they're assigned a hospital in most cases.
You can also interview your doctor, right? And so what kind of comes with that? Can you interview them even when you just go to the ER? Like what does that look like? Obviously you can interview them too when you're picking like an OBGYN. Talk about that interview process that people can do with their doctors.
You can. You should ask questions. It's important. When we think about the things that we do when we buy a new cell phone or a new piece of electronic equipment, we do our research, right? We want the best quality of phone, but for some reason, most of us don't do that when we need a pediatrician for our children, or someone in our family has become pregnant and needs an OBGYN. We don't do our research, so you're right. You can go in on your first appointment and you can ask questions, and you should. You should want to know, how long your physician, what his specialty is and what his focus is in. And, you can ask about judgments and other things, and it's up to the physician, to reveal it to you or not. So, many cases, if there is a problematic record, you may not find out that way. So you use these other tools like Cal Find Health and the Medical Board website. And like I mentioned, there's some things that are not available on the Medical Board website. So then what you want to do is go to your local online, to your local superior court, and run a search, a civil index and a criminal index search on your physician's name. And in the civil index search, you'll find out other people that may have tried to sue your physician and for why. And that will give you more information as well.
Thank you so much, Michele, for taking the time to, share all the resources and all the tools that you have in your toolbook. Thank you. Thank you again. We hope this special Do No Harm Loss and Liability in the Medical Field helped you, the community, remember the importance of asking questions as a patient, not just from your doctor, but all medical facilities and providers. Again, all of the resources we spoke about and all of the individual stories we told can all be found on our website, turn23.com. For this special edition, I'm Brianna Willis. Have a great night.